So why don't we get started? If I can, let's start by having the general surgery panelists just briefly introduce themselves to our medical student group tonight.
Dan, do you want to start?
Sure. So I'm Dan Dent. I'm by practice, trauma and acute care surgeon, although I finished my training 25 years ago and never did a fellowship in critical care or acute care surgery. And I am at UT Health San Antonio, been here my entire career. And I ran our residency program for 15 years, ending in this past June 30th when I moved into a vice chair for education role. And I'm also here representing the American Board of Surgery. I'm a member of the General Surgery Board under the American Board of Surgery.
Thanks, Dan. Alex, do you want to go next?
Yeah, I appreciate you having me here. My name is Alex Rains. I'm a general surgeon. I'm at the University of Oklahoma. I am also non-fellowship trained, which makes me very, very unique in an academic setting. I think I'm the only non-fellowship trained surgeon in our department, which when I first started 5 years ago was intimidating, and now I'm actually really proud of it, to serve as an example for you guys that you don't have to do a fellowship to be in academia. My clinical focus is in robotics, but I also do a lot of education. I'm the co-director for our surgery clerkship. So hopefully I can help you guys learn something about general surgery today.
Wonderful. And then Natasha, why don't we have you go next?
Hi, Natasha Carrick. I am also a trauma and acute care surgeon. I'm out of the University of Arizona in Phoenix, and I'm also the surgery clerkship director. And thank you for having me here tonight.
Wonderful. And then we'll go to Chris next, and then Marjorie after that, and then we'll get started, I think.
Hi, I'm Chris McHenry. I'm a general and endocrine surgeon. I practice in Cleveland, Ohio. I'm a professor of surgery at Case Western Reserve University and the vice chairman of surgery at Metro Health Medical Center. My background is I did my medical school at Northeast Ohio University's College of Medicine, and then general surgery training at Loyola University, followed by an endocrine and head and neck fellowship at the University of Toronto. And I've been in Cleveland, where I practice in both general and endocrine surgery for the last 32 years.
Okay. And I think that's all of our general surgery panelists. Did I miss anybody? Okay. If not, why don't we get started? And I'll monitor the questions and answers. But right now we don't have any. So maybe I can start with you, Dan. And maybe you can fill us in on what your pathway was to general surgery and what does general surgery really entail? We have a lot of students who just want to make sure.
So I went to medical school at the University of South Florida in Tampa, and I saw what was going on the rotations as an MS3, and really just found that surgery and the surgeons were kind of my tribe. They were the people that took care of things and were taking care of things at 2 o'clock in the morning when patients needed it most. And I really felt like they were the role model doctors that I wanted to be. But I think the one statement I can make that maybe will hit home a little is when I was an intern, a bunch of us interns got together and there was a New Year's Day party. And one of the urology residents' wives asked me, Dan, are you doing just general surgery? And I responded, no, ma'am, I'm doing all of general surgery. Your husband is doing just urology. And so to Alex's point about being proud about not being fellowship trained, I think, we general surgeons have a broad practice. We take care of things other people don't want to take care of, and we're kind of the safety net that helps people when they're in greatest need, and I'm quite proud of that.
So Natasha, one of the questions is, and it's sort of unusual to have general surgeons who also have an academic sort of practice and not in the White Tower where everybody's subspecialized. What is your work balance life like?
I love this question. I don't think there's anything balanced about work and life. I think that at least the way I can move forward and integrate the different aspects of my life. I have a toddler, I'm married, and I'm an academic surgeon, is thinking more about it as kind of driving a car. Sometimes you got to hit the gas pedal a little bit on the things that you want and you get. Sometimes you have to pump the brakes a little bit and slow down and maybe take some time for other aspects of your life, but it's a constant gas and brake. And I think if you think about it in those terms, it's a little bit easier because the work-life balance is challenging. There's this expectation that you have to be balanced, and you're not always balanced, and that's okay. There are some things that will take a little bit more of your time, but it's not forever. And I think as long as you understand those expectations, then it becomes more manageable. I think having this thought that perhaps everything is balanced and well balanced is a little bit of a myth. It's okay to be a little busier and work and maybe pump the brakes a little bit on some personal things and then flip it. But it's hard to do all of it at the same time, and that's okay. You can still be really successful and happy. And I think as once you hit those types of expectations that are a little bit more realistic, it really makes more sense, and you're more satisfied with what you're doing.
So maybe I'll switch to you now. Thank you, Natasha. Christopher, if I can ask, what's the best part of being just a true general surgeon, as opposed to being somebody who's super specialized into this thing or that? What makes your job so exciting?
Well, I'll tell you that I would liken it to the general surgeon is heavily involved in primary care. And I love that. I mean, it's we're not just not technicians. We're referred patients, patients that come to us with a problem, and we're involved in their diagnosis, trying to sort out what they have. And not only are we involved in their diagnosis, where we then treat the patient and then we follow the patient. It's oftentimes in my practice, I see patients initially and end up referring them to somebody else. But most of the time, the fun part for me is the combination of being able to have a role in the diagnosis of the patient, then treat them, and then follow their outcome. To me, that is very fulfilling as a general surgeon. The other thing,
Alex, you appear to be younger than most, or at least younger than me. What advice would you have for the medical student who's trying to figure out, how do I best position myself to enter the field of general surgery? What should I be doing now, as say a first or second year student, to get myself well positioned for the future?
Well, Dr. Schnartz, I have some lighting set up that's really great. You can't see my gray hairs, but they're there.
Okay. I was noticing actually the football.
Yeah, forever a fan. So I'm from Nebraska. I actually went to med school just about a half a mile away from you at the University of Nebraska Medical Center. So forever a hopeful Nebraska fan. But in terms of what students can be doing, especially in the first and second year, is just deciding if surgery is actually what you want to do. There are some students in that role or that position who have never been exposed to surgery before. And so just if you're in this webinar, then you're obviously interested. Don't feel pressured to do surgery by outside forces. I'm not too proud to say that I think that being a surgeon is the coolest job in the whole world and the best medical profession you could possibly encounter, but obviously I'm biased. But sometimes if you've been saying your whole life you're going to be a surgeon and then realize you don't want to do it, you're maybe embarrassed you don't want to. So find out if that's what you really want to do. Find surgeons to shadow. Go to clinic, which is blasphemy for a surgeon to say, but as Dr. McHenry alluded to, being a surgeon is much more than just operating. It's much more than cutting and sewing. In fact, the cutting and sewing is the easy part. Find out if you like what being a surgeon is like outside the operating room as well. We can talk about research and board scores and all that stuff, and that's easy to find on the internet. But what you want to really do is find out what life is like on a day-to-day basis. And as Dr. Carrick mentioned, work-life balance is never truly a balance, but it's about communication with both your colleagues and staff and also your family. And sometimes you're more at home than you are at work, and sometimes you're at work more than at home. But as long as expectations are managed on both sides, that's where the balance is truly lies.
So Dan, I won't ask Dan about barbecue this time around. I'm going to ask him a more philosophical question. And, what characteristics make a good general surgeon? It seems like it's a pretty broad field. What characteristics make a good general surgeon?
So, I mean, everybody in every specialty is looking for smart, hardworking, pleasant to be around at 2 a.m, good team player who communicates well, that type of person. But I really think the key in general surgery is the person who sees themselves as kind of a lifelong continuous quality improvement project, who can look around and see what their strengths are and figure out what maybe their weaknesses are and work on those. I mean, I did that as an intern. I saw that one of my fellow interns wrote better, faster, shorter discharge summaries than I did. So I started copying how he did his discharge summaries. And you can figure out how you can work on yourself and get better, because we all come to residency with some strengths and some weaknesses. Some have better communication skills. Some are better, insightful clinicians. Some, are just have a better attitude at 2 a.m. and don't get as fatigued. But you got to work on the things that are not natural strengths to you. And that's going to be important. I think it's important in life in general, but I think it's crucially important in general surgery. And that's what really makes someone successful in residency and thereafter.
So, Natasha, we have a question from the group, and that is, what is the biggest need that we as younger students can work to fill in the field of general surgery? What is the gap there? Where are general surgeons needed? And all of us here have a university affiliation, and we're going to talk about rural surgery. But what about in the academic realm? Where are the gaps that a general surgeon fills?
So that's actually a really interesting and good question. I have the unique opportunity to work in a community here in the Valley that has a lot of private surgeons and a lot of academic surgeons. So I get to see both worlds, so to speak, and I love the integration between the two. There is a lot of education that happens in community practice, especially training the young and up and coming students and the future residents, and they end up actually hiring a lot of the folks that they train here in the Valley to become their partners. So the gap that needs to be filled, I think it's not so much a gap. I just think that continuing the mission of education and continuing the mission of training the future is really important, regardless of where you end up, location-wise, or even if you go on to become fellowship trained. I think that is very, very important. The other great thing about general surgery is that I think we have alluded to that on this panel already. We are here to kind of fix the problem. We fill the gaps just by our flexibility. We are also surgeons that take care of patients as in primary care. So there is a lot of flexibility. For example, with the COVID pandemic, a lot of the critical care surgeons, general surgeons, bariatric surgeons all pitched in to cover not just critically ill patients, but all patients that were coming during a pandemic. And that really showed what the general surgeon can flex to do. And I think we need to continue that. And I don't think that's necessarily a gap. I think that is perhaps more opportunity to keep growing. So I hope I answered that question.
Yeah, thank you. Chris, one of the interesting things I think that concerns students as they're trying to sort through their career choices is, you mentioned primary care and the importance of having that relationship, but what about sort of the technical skills? A number of students are worried because, they don't actually get to do the technical skills on their clerkship. Is that part of your acceptance criteria into residency, or how does one learn those skills as they go along? Because as a student, it appears suturing up a port site might not isn't all their how do I get better at that?
Well, so I don't think the expectation is, as you when you begin your residency, the expectation is that you're not to have skills that are already mastered. That's what your residency is for. But you can prepare by learning how to tie, practicing how to tie good knots. We have as a fourth year program in our medical school, a surgery boot camp, where you get exposure to surgical anatomy and some basic skills. But the expectation is that you're going to learn those skills. You're going to be taught that during your residency. But it helps to have at least some preparation in some basic skills, like knot tying in preparation for to start your residency. But those are not, I would say those are not major expectations. Those are things that you're going to learn during your surgery residency.
So what I might do is we've got about 7-8 minutes left. So what I'm going to do is I'm going to throw a curveball to each of you, and I'm going to start with my friend Dan Dent, and that is, if you were to give a 2-sentence piece of advice for the student who's interested in surgery, and I'm going to ask each of you the same question, 2 sentences, best advice you can give somebody who's considering general surgery, what would those 2 or 3 sentences be?
If you can find another specialty you like just as much, do the other specialty, because surgery is really hard and there's no getting around that. And that's true in residency. And it's likely going to be true at least for the first 5 or 10 years out in practice, because emergency room call coverage is the thing that's needed most. And so that would be the probably most straightforward thing I could say. And then we've seen a number of applicants and residents that seem to be kind of like people are in love with the idea of being in love, but they don't want to do the work they're necessary to maintain a long-term relationship. There are people that like to tell people in the bar, I'm a surgeon or I'm a surgery resident, but you got to love the work. You can't love the idea of being a surgeon. You have to love the work of being a surgeon. And if I love the work of being a surgeon, those of us here love that work, but you've got to love it day in and day out for decades to come.
Thank you, Dan. Alex, 2 to 3 sentences, best advice for somebody thinking of considering a career in general surgeon.
I'm glad you chose me next, because almost exactly what Dan says. I have almost a rote speech I give to students who come to me with this. I tell them, do not be a surgeon unless you love being a surgeon. And that's not to discourage them, but that's to tell them it's really hard. It's hard intellectually, it's hard physically, it's hard emotionally. It's very challenging, but there is no job on the planet that is more fulfilling than being a surgeon.
Natasha, what 2 to 3 sentences do you have for our 75 applicants here?
Be kind, keep an open mind, and understand that surgery is a hard residency, it has a lot of grit and grind, but it's like training Navy SEALs. We're here to save lives. It has to be that way. And it is a very fulfilling and an extremely just lovely career that I can't imagine doing anything else. And I loved my residency. Not all residency has to be thought of as something as negative. It is 5 years to learn everything you need to learn, or maybe 7 if you're in San Antonio. But it really is a wonderful residency program. And I think that you have to think about it open-mindedly, be positive, but understand what you're doing. It is very serious. And once again, if you want to be a Navy SEAL, you got to train like a Navy SEAL. So that's the advice I give to our students.
Wonderful. And last, Chris, 2 to 3 sentences, best advice for somebody considering the field.
Sure. So I think first and foremost, it's already been articulated, but to thine own self be true. Do what you love. And if you love general surgery, work hard and try to learn as much as you can. Learn from your teachers. Try to take what they learn from them. You may not do everything the way they do it eventually, but try to learn from them and keep an open mind. Work hard and be open-minded, and just to try to excel at what you do.